And welcome to another Mark Bishop Show. Well, folks, March, you know what it is? World Sleep Month. And I bet you already know you can get better sleep by muting the snorers. As the fingers go out at each other, I know. Well, it is World Sleep Month in March, and according to research conducted by one poll, 51% of Americans snore. While it can sometimes be seen as something to laugh about, 39% of Americans who snore, they got to live with someone who snores, and they say their sleep is disrupted between 1 and 3 times each week. And that sounds like my wife and I. We're both guilty. And it's leaving them so tired that 34% are oversleeping. Is that you? And 24% have fallen asleep at work. Now, that's lousy. The sleep doctor, who's going to be my special guest in just a tick, is Dr. Michael J. Breus, Ph.D., clinical psychologist for Diplomate of the American Board of Sleep Medicine and fellow of the American Academy of Sleep Medicine. Welcome, Doc.
Thanks for having me, man. I'm excited to be here.
All right. Well, this severe snoring, where the snorer stops breathing between inhalations, may be a sign of sleep apnea. Should be checked, right, by a sleep specialist, Dr. Breus?
100%. So if you're lying next to somebody who snores, while I know that that is super annoying, in fact, we did a survey, believe it or not, we surveyed 2,000 people, asked them all kinds of questions about snoring. Turns out 21% of people say that their snoring bed partner is one of the most annoying things that's in their lives. So not only is the snoring person not sleeping so great, but the not snoring person, the person that's listening to the snoring, we know they're not sleeping well. Right. But more importantly, that's the person who can maybe see if you have sleep apnea. So one of the things that I tell people all the time is snoring is kind of on the spectrum of sleep apnea. Roughly, and our survey data confirmed this, roughly 51% of the American population snores, which is kind of a big number, yet only 18% to 12, depending upon gender and a few other factors, have sleep apnea. So not everybody who has not everybody who snores has sleep apnea, but just about everybody who has sleep apnea snores. And so when we look at these disorders, we have to treat them kind of like preemptive. So if you're sitting there snoring and somebody has heard you snoring and you're rattling the walls, that's a warning sign that your health is not going to be good.
Yeah, it's a worry. Well, you know, many people breathe through their mouth, which causes a vibration in the back of the throat, and that can result in the snoring, as we know. But there's good news, folks. Mute. We're going to talk about Mute. It's an FDA-approved nasal dilator. It sits inside the nose to increase airflow. It improves nose breathing and reduces snoring. And in product trials, here's some statistics for you. 78% of Mute users could breathe better, and 75% snored less. And 59% of snorers are ages between 45 to 54, 56% 35 to 44, and 54% are ages 55 to 64. And a further statistic shows that 51% of U.S. adults who snore are men, and 57% of men admitted to being a snorer. This thing's going to fly off the shelf, isn't it?
It's crazy. And here's the thing. You know, when I've been looking for snoring treatments, and it is going to fly off the shelf, I agree with you. I've been looking for snoring treatments for my patients for a long time. And here's the problem. It's a physical issue. It's a nasal tissue congestion, crowded mouth issue. And so we've got to do something at the core root or cause. Otherwise, we're never going to be able to fix the situation. So there's a lot of things that I tell people that they should consider doing. Number one, you should get more sleep because you're probably sleep deprived. Number two, don't drink alcohol right before bed. Number three, lose some weight. There's a lot of data to suggest that even a 5% weight loss, so if you're a 200-pound person and you drop 10 pounds, you should pull about 30 decibels off of your snore and make your bed partner's life a lot easier. Then there's also the idea to decongest for better rest, where I ask people, hey, I want you to decongest and get all of that drainage out of there. But again, all of these methods take time. What I liked about Mute as an internal nasal dilator, I pop it in, I stop snoring immediately, and my wife is thrilled. So it's a very small piece of plastic that goes, it's actually FDA approved, all natural, and it goes right into the nostril, and it actually widens or opens up the nostril merely to get more air in your nose. And it's remarkable how well it works. And I'll be honest with you, I don't just use it at night to snore, even though I could. I actually use it in the morning during my meditations because it helps me breathe better. And I use it on my runs and my cycling because I can actually go faster and farther.
Well, the thing must clip in then and hang on if you can do that, while running.
Right.
It doesn't fall
Absolutely.
out. That's
it's
pretty
great.
good. So here's one I got for you out of left field. Why do you think, Michael, that more than any other region across America, 53% of residents in New York, Washington, and Connecticut, right? New York, Washington, and Connecticut, and the surrounding states keep their partners or housemates awake from snoring? Yep. Is it the weather?
Yes. So I'm going to actually go out on a limb here, and I'm going to say that, yes, I think it is the weather. And I'll tell you why. So number one, it's cold. When it's cold weather, people have a tendency to stay indoors. So they're not active and they're not exercising as much. Also, when it's cold out, people like to eat comfort foods, right? So stews and meats and all these good things that make us feel good and warm and comfortable and things like that.
Yummy.
I think. Oh, yeah. And so when the survey was done, it was done towards the end of the year when it's cold outside and all the holidays are there. So if I had to guess, my guess would be that maybe people had a tendency to put on a few extra pounds in the Northeast, and that's what started with the snoring. That certainly could be one possibility for sure.
What causes people, pretty generic, boring question, what causes people to snore at night?
So it really is this physical issue. So it's everything that has to do with your nasal obstruction. Let me, I have a great description of it here. So when we look at what is snoring and kind of how does it happen, we have a narrowing of the airway during sleep. So what does that mean? It means your pipe is getting crushed somehow, some way. So, the muscles of your airway, including your mouth, your nose, your throat, they relax, and these passages, these airway passages, they become smaller because of this relaxation of the tissue. When air is moving through these narrowed passages, it's very simple for the soft tissue there to vibrate, which causes a cadence and causes a snore. So it's actually all physical. This is one of the reasons why, by the way, if you lose weight, this will help, is because it will actually widen some of those areas. What mute does is it widens your nasal passages so that way you get more air in.
Mm-hmm. Well, you're right about the losing weight. You're right about don't drink alcohol late before you go to bed. What are some other reasons people snore?
Well, so sometimes people snore due to medications. Sometimes people snore due to their sleep position. There's actually a whole host of different reasons why people snore. Sometimes people even go as far as to, if sleep position is a problem, let's say they sleep on their back. We all know that people have a greater tendency to snore when they sleep on their back. Some people go out and they buy adjustable base beds. So these are those older beds that you used to see that can raise the head of your bed. I have one, and I got to tell you something, I love it. I can raise it up to watch TV, but I can also raise it up. My wife can raise it up if I snore at night, and it doesn't bother me at all, and it takes gravity right out of the equation.
Well, there you go. This thing sounds marvelous. Folks, www.mutesnoring, one word, MUTESNORING, mutesnoring.com. What can they expect to find there, Michael?
So we give a lot of information about how it works, how to figure out your sizing and things like that. What I tell my patients to do is go on Amazon, type in Mute Snoring, and go for the purple trial pack, because it's got all three sizes in it, and then you and your bed partner can fiddle around with it and figure it out. I use mine for about 7 to 10 days. So I'll use it in the evening. I may use it, like I was telling you before, for my meditation and for my exercise. Then I will wash it off with just some warm water and soap, and then let it dry on a paper towel and have it ready for the next night.
How about that? You make it sound so simple. It sounds like a beaut thing. Well, there you have it on the Mark Bishop Show, folks. The Sleep Doctor, Michael J. Breus, Ph.D., clinical psychologist, for Diplomate of the American Board of Sleep Medicine, and fellow, of course, can't forget that, of the American Academy of Sleep Medicine. He's no idiot. And this topic is very scientific, isn't it, mate? I mean, it's not just, simple as that.
It is. Yeah. And I mean, it's pretty amazing that, we've got lots of sleep scientists out there who are studying it, and that sleep has such a profound effect on our overall health. I really appreciate you having me on your show to educate your listeners, because I know they could all benefit from not having a snoring bed partner, or if they themselves are snoring, hopefully getting some relief.
You did right. Thank you, Dr. Breus. Pleasure speaking with you.
You bet.